Hi, this is George Glaser, and we are here today with Ayelet. And Ayelet is a graduate student at the University of Maryland counseling program. She's in her fourth year. And in June 2015, she attended an ASCH basic program, ASCH basic training. And today I'm going to talk with her about that. So, good morning.
Hi.
Hi. So, can you tell me how you decided to go to the training?
So in my third year of my graduate school program, I was doing clinical work, and my supervisor was Dr. Sharon Spiegel, who is involved with ASCH and uses clinical hypnosis in her practice. And over the course of our year of work together, as we would discuss my clients, sometimes she would make comments like, if I were working with this client and I were going to use clinical hypnosis with them, here are steps that I could take. Or it's too bad you can't use clinical hypnosis with this client because this would be a useful intervention. And so I kind of got exposed to the idea of clinical hypnosis as a tool that you could use in practice that could be really, really useful in a lot of different cases. And so at some point, she asked me if I would be interested in attending a training, the ASCH training in Virginia. And I was very interested because at that point, I had already heard so much about the ways that it could be used in practice that I thought it would be a really useful skill to have.
That's great. So what are some of the things that you came away with from that first training?
Well, I really went into it not knowing a lot other than what Dr. Spiegel had spoken with me about. So when I first attended the workshop, I really didn't know anything about clinical hypnosis other than what Dr. Spiegel had told me. So just really learning what it was and how it could be used and kind of dispelling myths was a big part of it for me. Understanding how to talk about it with other professionals and clinicians and clients in a way that makes it seem like a viable tool was really important for me.
What were some of the ideas that you went into it with about what hypnosis was? I mean, I know you had some idea based on your conversations with Sharon, but what did you think about? What did you think hypnosis was?
I mean, I didn't have a very clear idea. Based on my experience in supervision, I had some ideas of what you could do with it, but I didn't actually know what it was. And I think that, like a lot of people, my exposure to hypnosis is kind of through pop culture or stage hypnotists. And I was really interested to see what it would look like to be trained in clinical hypnosis and how that would be different. Mm-hmm. What you would do with suggestions other than telling someone to do ridiculous things on stage.
And in your graduate school training, was there? Did you receive any training in hypnosis? Any mention of it? What part did it play in your graduate school training?
Well, in my official training, even though we get really intensive and thorough clinical training, hypnosis or hypnotherapy wasn't really mentioned ever as a tool that we could use. I think that even though my program is affiliated with a really wide net of clinicians in the area and really respected clinicians, not many people practice hypnosis, and it's not really something that's talked about or discussed in my program.
That's so interesting. Mm-hmm. Having been professionally involved with hypnosis for 35, 37 years at this point, it's really quite amazing.
Yeah.
So how have people, how have people in your program reacted, or do you talk about your experiences with the training?
I do. Yeah, I do actually talk about it. I think I tend to bring it up a lot because now that I know about it, I can see ways that it's really applicable in different situations. And I think that people in my program have responded very positively and with a lot of curiosity about my training and what I learned. They ask a lot of questions. I think that it made people more curious about hypnosis as a tool and what they could do with it if they were trained in it also.
Wonderful. Okay. What do you see yourself doing in the future with hypnosis?
Well, I definitely want to work in a clinical capacity in my future. And while right now I can't use hypnosis in my clinical work, I do hope to incorporate it into my work in the future as a clinician. So I'm planning on attending the next regional workshop in Virginia in summer 2016, the intermediate workshop, to kind of continue my training and to stay involved.
Okay.
ASCH, yeah.
So is the reason that you're not able to use it because you're still a student? Is that the reason you can't use it right now?
Yes, the reason is because as a student, my clinical work has to be supervised by licensed psychologists, and the psychologists that I'm currently working with do not use hypnosis, and I'm not allowed to operate outside of the scope of my supervisor's knowledge.
I see.
So even if I have the skills, I can't use them unless someone can oversee them.
I see. I see. Okay.
Yeah.
All right. Are there any other things that we have not spoken about regarding your experiences in the training, in terms of what the training was like, how it was set up, that you'd care to comment about?
Yeah, well, I think I mentioned how involved it was and how hands-on it was. And I think I really appreciated the opportunity to learn skills and then actually go and be able to practice them and feel like I was competent enough to actually use these skills on another person. I think that was very good in terms of confidence and affirming my ability to continue developing in this area.
Okay.
And I also think that seeing the different types of professionals that attended this workshop, so there were psychologists, therapists, clinical workers, but also dentists and doctors, and just hearing from the instructors the variety of ways that clinical hypnosis skills could be used in so many different professions and areas really made me think about how useful it is in so many different clinical professions.
Well, that's always been one of the big draws for me, is that exactly that process you're talking about, because I get to learn so much from other professionals as well. Just the questions that come up in a workshop from the different disciplines are wonderful. So, thank you very much.
Thank you.
It's been wonderful speaking with you, and I hope you continue your contact with hypnosis and your use of it. And it's been a great pleasure talking to you. Thank you.
Okay, thank you.